The following training is presented to you by the Center for Health Systems Analytics at the University of Texas Health Science Center in Houston. Our goal is to disseminate information on mental health and substance use issues as they affect first responders and healthcare workers. While all trainings are geared toward these particular audiences, we believe that this information will be invaluable to anyone who seeks to expand their knowledge on topics of mental health and substance use disorder. The present training aims to address specific mental health challenges faced by first responders and healthcare workers during the COVID-19 pandemic. We will discuss commonly experienced symptoms of psychological distress, understand the unique challenges faced by members of the workforce, and tools to build resilience in the face of this unprecedented challenge. The COVID-19 global pandemic presents a unique instance of collective trauma in which a large group of people experience a shared traumatic event. Variations exist among the individual experiences of the traumatic event, but typically events such as natural disasters, war, abuse, sexual assault, economic collapse, and mass casualty events elicit similar psychological distress among victims and their loved ones. Rescue workers, first responders, and healthcare workers are not immune to these experiences of trauma and are often faced with additional unique stresses. As of July 8, 2021, there have been close to 185 million confirmed cases of COVID-19 and almost 4 million deaths globally. A traumatic event presents itself as a threat to an individual, and the body responds as it would in any threatening scenario. This includes the release of multiple stress hormones and the activation of the central nervous system in what is commonly referred to as the fight, flight, or freeze response. Typically, once a threat is mitigated, the body returns to regular functioning. But if that stressor persists, the central nervous system will continuously activate these defensive mechanisms, and the experience of trauma will continue to affect the individual both physically and psychologically. Many people are wondering if their experiences of psychological distress are normal or significant. It should be noted that in this particularly abnormal state of affairs, the necessary adaptations required will typically produce some level of psychological or emotional dysregulation. This is a normal response to an abnormal set of circumstances, but it may be time to seek help if symptoms of your trauma begin impeding on interpersonal, academic, occupational, or social functioning. The CDC conducted a survey to gauge psychological and behavioral effects that physical distancing and stay-at-home orders have had on the general population in the United States. The results presented us with the striking reality that COVID-19 has had a profound effect on mental health in a very short period of time. Results of the survey demonstrate that symptoms of anxiety disorder and depressive disorder increased considerably in the United States in 2020 compared with the same period in 2019. Overall, over 40% of respondents reported at least one adverse mental or behavioral health condition, including symptoms of anxiety disorder or depressive disorder, symptoms of a trauma and stressor-related disorder related to the pandemic, and having started or increased substance use to cope with stress or emotions related to COVID-19. The percentage of respondents who reported having seriously considered suicide was significantly higher among respondents aged 18 to 24 years, as well as among minority, racial, and ethnic groups, self-reported unpaid caregivers for adults, and essential workers. Some factors contributing to the rising rates of mental health and substance use issues include the heightened fear of exposure and infection and the duration of that exposure. Additionally, persons who have previously experienced mental health or substance use issues will be more susceptible to developing symptoms of psychological distress, as will those who lack adequate support. As social, occupational, and public health challenges increase, so does psychological distress. It's important to note that symptoms may appear after the outbreak is under control, and they do typically subside over time. However, there remains the possibility of relapsing into states of psychological distress, especially if individuals have pre-existing mental health conditions, and if they're pre-exposed to additional or related challenges. A recent article in the American Journal of Disaster Medicine explains that disasters such as the COVID-19 pandemic are often characterized by chaos and uncertainty. As a result, public health disaster planning and response represent formidable challenges. Although disasters can result from a wide array of hazards, Regardless of the agent at work, they may follow a rather predictable trajectory of psychological phases. Given the unprecedented nature of the global pandemic and the uncertainty associated with any disaster, the typical timeline for disaster response can vary in order, frequency, duration, and intensity of phases. It is thus entirely normal to find oneself experiencing multiple phases at one given time, depending on individual circumstances related to the disaster. The typical trajectory of disaster can be characterized in three main phases: the pre-disaster phase, the impact phase, and the reconstruction phase. Psychological response follows the same trajectory: the pre-disaster phase, the impact phase, and the reconstruction phase. The pre-disaster phase is characterized by fear, uncertainty, vulnerability, a lack of security, loss of control, and guilt or self-blame. The impact phase is divided into three characteristically different events: heroic, honeymoon, and disillusionment. Adrenaline-fueled altruistic response and motivated rescue efforts create a surge of activity and community cohesion, fostering optimism that the disaster will soon come to an end. Inevitably, this optimism gives way to the reality of limited resources and the severity of the crisis at hand, often leaving individuals feeling as though their efforts were in vain. At this point in disaster response, individuals are most susceptible to psychological distress and perhaps even developing unhealthy coping mechanisms. The disillusionment phase for rescue workers and healthcare staff includes multiple variations of occupational stress, which may ultimately impact the quality of service provided. Finally, toward the end of the crisis, we begin to see a phase of reconstruction and recovery, characterized by overall feelings of adjustment and rebuilding while continuing to grieve losses. The psychological response is likely to vary over the phases of the outbreak. These stages may not be sequential depending on the course of the outbreak, and people may rapidly cycle through. As we've seen through the COVID-19 pandemic, reconstruction phases are sometimes cut short by setbacks or recurring waves of the disaster. Understanding the typical stages and trajectory of psychological responses in times of disaster may allow us to build resilience. As we will learn later, resilience depends on identifying our psychological experiences in order to adapt and cope in a healthy manner. The phases of psychological response to disaster are especially pertinent to rescue workers, healthcare workers, and first responders who are on the front lines providing services and resources to the general population. This hero narrative can become extremely difficult to bear, given that each of these heroes is also an individual facing the very same crisis as everyone else. This ultimately compounds the stresses that members of this workforce are faced with. SAMHSA, the Substance Use and Mental Health Service Administration, in its documentation on disaster responder stress management, cites the following typical responses for disaster response staff, over and above the elements of psychological distress discussed earlier. First responders, healthcare workers, and other rescue workers may experience additional stress due to their personal experiences and direct exposure to the negative effects of the disaster, perhaps contracting the virus or losing a loved one. Faced with exponentially higher numbers of patients and far too few resources, stress from the repeated patient encounters, positive and negative, accumulates and compounds the already chronic levels of stress that these workers deal with in their professions. Many become overwhelmed by the depth of others' grief and sadness, and frustrated when they're unable to alleviate the pain of others. Healthcare workers work extremely long hours in difficult environments, and additional organizational tensions such as insufficient supervision or inadequate leadership further compound their levels of stress. Many rescue workers and healthcare workers experience dissonance with the hero narrative, especially those who have had to deal with losing more patients in a limited period than in their entire careers. Reckoning with this loss may foster feelings of disillusionment in their profession and organization for any failures to provide adequate resources or care. At this point, rescue workers and healthcare workers are susceptible to moral injury, a unique category of psychological distress that will be expanded upon later in this training. Of course, all the occupational stresses become mingled with individual lives, exacerbating additional tensions at home. For those with pre-existing mental health concerns, this is a critical moment to activate and strengthen resilience. From June through September 2020, Mental Health America hosted a survey to gain insight into the experiences of healthcare workers during COVID-19. Most healthcare workers are resilient and will not experience lasting distress. However, depending on stress during the response, 10 to 20% of healthcare workers are at risk for a new disorder that they didn't have before the event. Here, the term healthcare worker intends to capture patient care staff, nurses, community-based healthcare workers, doctors, support staff, first responders, and physician assistants or nurse practitioners. The largest group of respondents were healthcare workers and staff and nurses. 19% of respondents identified their position as other, which included mental health professionals, social workers, and pharmacy staff, among others. The data collected indicated that respondents are stressed out and stretched too thin, experiencing ever-increasing levels of stress, anxiety, frustration, exhaustion, burnout, and being overwhelmed. 3 in 4 healthcare workers with children reported that they were worried about exposing their child to COVID-19, and nearly half were worried about exposing it to their spouse or partner. Almost 50% reported concern about potentially exposing older adult family members. Among people with children, half reported that they are lacking quality time and are unable to support their children or be a present parent. An important element of this training is to indicate that if you're experiencing psychological distress during the COVID-19 pandemic, you're not alone. By recognizing that these experiences are more common than you previously thought, you may feel validated in your own experience and be able to find or provide support to your peers and colleagues. Mental Health America reports that stress was the most commonly reported feeling, with 93% of healthcare workers indicating that they had regularly experienced stress during the COVID-19 pandemic. This was followed by anxiety, frustration, exhaustion or burnout, and feeling overwhelmed. Gratitude, hope, and pride were reported by fewer people, although nearly a third reported that they regularly felt gratitude. The following slides will hopefully allow you to identify and articulate some of your stresses and empathize with your peers and colleagues. Data gathered by the Mental Health America survey indicated that 82% of healthcare workers and first responders were likely to report increased emotional exhaustion. 70% reported trouble with sleep, 68% indicated physical exhaustion, and 63% reported feeling work-related dread. Over half of the healthcare workers also reported experiencing changes in appetite, physical symptoms like a headache or stomach ache, questioning their career path, compassion fatigue, and heightened worry or attention to being exposed. When asked about emotional support, the largest group indicated that they did not feel that they had adequate emotional support. Another 26% were unsure if they were receiving adequate emotional support. Over half of healthcare workers were receiving emotional support from family members and friends. Many healthcare workers also reported receiving emotional support from their same-level co-workers. When asked to select their top 3 work-related stresses, 61% reported uncertainty about when things will settle down or return to normal, and 54% reported experiencing burnout. Nearly half also reported that their heavy or increased workload was a major stressor in the previous 3 months. When asked about their top 3 home-related stresses, the majority of respondents reported that they were too tired when they got home from work to do home-related tasks such as cooking and chores. 41% of healthcare workers reported loneliness as a significant stressor, and over 40% reported financial distress. Not being able to support children or be a present parent was a major stressor, as well as a lack of quality time with their children as a result of COVID-19. The complexity of responding to COVID-19 may result in conflicting personal and professional demands, including continued daily workload demands competing with COVID-19 preparation and treatment measures, a need to maintain high standards in the face of a low-frequency event within which official recommendations and policies change regularly, possible separation from and concern about family members, fears about infection and subsequent implications for self, patients, and family, and inner conflict about competing needs and demands. Patient death under normal circumstances can result in grief, stress, and anxiety. During the COVID-19 crisis, healthcare workers are experiencing greater than normal patient loss, together with an increase in patients and limited resources to meet needs. Grief for patient deaths can be amplified in stressful environments. This cumulative grief can negatively affect the health of healthcare workers and the quality of patient care. Under normal circumstances, healthcare workers have more time to grieve and manage stress following the death of a patient. With increased deaths, the behavioral health impact of grief and the risk of burnout increase. This can result in compassion fatigue, low morale, exhaustion, burnout, and errors that could harm patient care. Compassion fatigue is a common experience among first responders and healthcare workers who have experienced considerable levels of work-related stress and trauma. The Professional Quality of Life Scale has been developed to assess compassion fatigue, burnout, secondary traumatic stress, and compassion satisfaction among individuals in helping professions. Compassion satisfaction refers to the satisfaction one derives from being able to perform one's job well. Healthcare workers and first responders may experience compassion satisfaction when they feel good about saving a life or helping people overcome challenges. Positive regard for co-workers and the ability to serve the community both contribute to one's sense of compassion satisfaction. Compassion fatigue refers to the experience of dwindling satisfaction in caregiver roles. Compassion fatigue involves overlapping experiences of burnout and secondary trauma. Burnout is associated with feelings of hopelessness and difficulties in dealing with work or doing your job effectively. These negative feelings usually have a gradual onset. They can reflect the feeling that your efforts make no difference, or they can be associated with a very high workload or a non-supportive work environment. Secondary trauma refers to caregivers' exposure to extremely or traumatically stressful events. Developing problem due to exposure to others' trauma is somewhat rare, but does happen to many people who care for those who have experienced extremely or traumatically stressful events. The symptoms of secondary trauma are usually rapid in onset and associated with a particular event. They may include being afraid, having difficulty sleeping, having images of the upsetting event pop into your mind, or avoiding things that remind you of the event. Signs of burnout include sadness, depression, or apathy, being easily frustrated, blaming others or being irritable, lacking feelings or being indifferent, isolation or disconnection from others, poor self-care or hygiene, feeling tired, exhausted, or overwhelmed, feeling like a failure or nothing you can do will help, feeling that you're not doing your job well, or feeling that you might need alcohol or other drugs to cope. Signs of secondary traumatic stress include excessively worrying or fearing that something bad might happen, easily startled or on guard all of the time. One might experience physical signs of stress such as a racing heart, nightmares or recurrent thoughts about the traumatic situation, and the feeling that others' trauma belongs to you. If you know that you're at risk for compassion fatigue, taking the time to learn the signs and symptoms can be a helpful means of prevention. The most common signs and symptoms of compassion fatigue include reduced sympathy or empathy, dreading working for or taking care of another and feeling guilty as a result, hypersensitivity or complete insensitivity to emotional material, feelings of inequity toward the therapeutic or caregiver relationship, a poor work-life balance, or a diminished sense of career fulfillment. Burnout or compassion fatigue may be a response to workload demands, poor organizational practices, intense time pressures, unsupportive relationships with supervisors and co-workers, or a lack of control across work environments. Together with compassion fatigue, moral injury is a unique response to the particular stresses facing healthcare workers and first responders. Moral injury, sometimes known as moral distress, refers to the psychological, behavioral, social, and/or spiritual distress experienced by individuals who are performing or exposed to actions that contradict their moral values. Frontline healthcare workers may be at higher risk for moral injury during the COVID-19 pandemic because limited resource availability restricts their ability to provide the normal standard of care. Additionally, some healthcare workers may need to isolate at home during COVID-19 symptoms and may unknowingly transmit the virus to a loved one. Healthcare workers who are isolated or quarantined are not able to return to work immediately, and this might also produce guilt, shame, or anger, or other feelings of betrayal. Two key sources of moral injury include situations where an individual's own actions or decisions transgress their previously held values, resulting in feelings of guilt and shame. Also, situations in which another person's actions violate an individual's value system, resulting in feelings of betrayal. Some examples of the potential events that lead to moral injury include the loss of a vulnerable person, such as an elder or a child, situations where death may have been the result of insufficient resources or staffing, having to save one patient over another due to limited equipment or resources, and particularly when these issues are perceived to have been preventable. Moral injury might also be caused by following clinical instructions that the worker feels are immoral, or issuing directions that result in the death of a patient. Moral injury is not an illness. However, there are feelings or symptoms that may result from moral injury, including persistent feelings of guilt, shame, and anger. Many people experiencing moral injury report feeling betrayed and subsequently distrustful of their profession, leading to a loss of meaning and purpose in their work. Psychological and behavioral changes due to moral injury are similar to those observed in cases of excessive stress, grief, and compassion fatigue. Many of these changes resemble symptoms of depression and anxiety, and identifying them early may prevent the injured party from developing further serious mental health issues. Some of these changes include self-isolation and avoidance, hypervigilance, drastic changes in worldview, intrusive memories or difficulties concentrating, social problems, compulsive behaviors, demoralization, and self-harming behaviors. Psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious mental health problems, or workplace and financial stresses. As much as resilience involves bouncing back from these difficult experiences, it can also involve profound personal growth. The main components of resilience are knowing when you're stressed and how to manage it, healthy thinking, including recognizing and correcting distorted thoughts, focusing on positive emotions and experiences, social support, and healthful sleep, eating, and exercise habits. Being resilient doesn't mean that a person won't experience difficulty or distress. People who have suffered major adversity or trauma in their lives commonly experience emotional pain and stress. In fact, the road to resilience is likely to involve considerable emotional distress. While certain factors might make some individuals more resilient than others, resilience isn't necessarily a personality trait that only some people possess. On the contrary, resilience involves behaviors, thoughts, and actions that anyone can learn and develop. The ability to learn resilience is one reason research has shown that resilience is ordinary, not extraordinary. Like building a muscle, increasing your resilience takes time and intentionality. Focusing on 4 core components, connection, wellness, healthy thinking, and meaning, can empower you to withstand and learn from difficult traumatic experiences. To increase your capacity for resilience and to weather the difficulties, use these strategies. The first step to building resilience involves identifying which aspects of the response are likely to be most stressful for you. Some commonly reported stressful events for rescue workers and healthcare workers during the COVID-19 pandemic include the proper use of PPE or infection control protocols, lack of organization and role clarity, changes in workflow and responsibility, limited resources or supplies, altered standards of care and ethical challenges or moral injury, separation from usual colleagues, witnessing the death of patients, illness and death in colleagues, challenging team dynamics, fear of contracting the illness, concerns for the safety of your family and friends, feeling misunderstood or feeling pressure to justify your work, stress with re-entry into your regular unit, stigmatization, a lack of appreciation from the public, fatigue and limited rest time, personal and team pressure to succeed in the patient care, and multiple levels of self-doubt. The next component of building resilience involves healthy thinking. To do this, we must keep things in perspective. When feeling overwhelmed, it's important to remember that some things are simply out of our control and that we can only do our very best moving forward. Remember that what has happened is not an indicator of what will happen in the future. We must learn to accept change. If we remain open to change and adaptation, we will be less likely to become overwhelmed when the unpredictable occurs. Change is natural, and if we are adequately prepared, we can find positive outcomes in the new way of doing things. Try to maintain a hopeful outlook. COVID-19 has proven how difficult it is to maintain optimism when disaster persists. One way to try and keep our thoughts positive is to spend our mental energy focusing on what we want rather than what we fear. Try to learn from your past. We're always learning and growing, and in times of distress, it may be helpful to reflect on how we've faced challenges before now. It's empowering to remember that we have survived difficulties before, and it's valuable to access the tools and strength that allowed us to overcome those difficulties. Finally, be mindful of distorted thinking. Try to recognize thoughts that are not helpful and correct them, realigning them with keeping them in perspective. Wellness is the next component in building resiliency. Take care of your body. Self-care might be a popular buzzword, but it's also a legitimate practice for mental health and building resilience. That's because stress is just as much physical as it is emotional. Promoting positive lifestyle factors like proper nutrition, ample sleep, hydration, and regular exercise can strengthen your body to adapt to stress and reduce the toll of emotions like anxiety or depression. Perhaps try to practice mindfulness. Mindful journaling, yoga, and other spiritual practice like prayer or meditation can also help people build connections and restore hope, which can prime them to deal with situations that require resilience. When you journal, meditate, or pray, ruminate on the positive aspects of your life and recall the things that you're grateful for, even during personal trials. Finally, try to avoid negative outlets. It might be tempting to mask your pain with alcohol, drugs, or other substances, but that's like putting a bandage on a deep wound. Focus instead on giving your body the resources to manage stress rather than seeking to eliminate the feeling of stress altogether. A lack of sleep and sleep interruptions contribute to stress, and addressing sleep disturbances is one step toward building overall resilience. When possible, work to maintain regular sleep schedules. Aim for 8 hours of cumulative time in bed over 24 hours, preferably during nighttime hours if not doing shift work. Avoid staying in bed if you're awake for more than 20 minutes. Instead, get out of bed and do something non-stimulating like reading a book until you feel sleepy again, and then get back into bed when you are sleepy. Finally, communicate with leadership if your shifts or rotations need changing to allow for appropriate sleep. Physical activity is an essential component of maintaining resilience, as it contributes to the efficacy of sleep and produces natural endorphins that combat stress. Take the time to engage in moderate intensity exercise such as a brisk walk for 30 minutes a day. Those 30 minutes can be broken down into smaller blocks of time, such as 3 10-minute blocks. In order for our minds and bodies to function optimally, we need the correct fuel. Our energy levels directly affect our stress levels, and nutrition affects our ability to function physically, to sleep, and to think clearly. If you are forgetting to eat regularly, try to set alarms for food breaks. If possible, keep snacks with you and take short breaks from work while eating. Even if it's only for 5 minutes, take a break for snacks. Maintaining regular physical hygiene practices is not only healthy for the body but for the mind. To build resilience, try to stick to a routine, and if possible, try to do things like brush your teeth and shower at the same time every day. These may seem like simple tools, but regular practice of healthy habits has been shown to increase positive mental health. Connecting socially is an essential component of resilience that buffers the effects of stress. Some studies have shown that loneliness and isolation can be just as harmful as obesity and smoking. It's important to know that you're not alone in the midst of your difficulties, and being with trustworthy individuals may validate your experience and reduce your stress. Be aware of who you can turn to on a regular basis and also during crisis events. Consider how you maintain your contact, how frequently, and how will you allow yourself to enjoy social connections outside of work. Along with one-on-one relationships, some people find that being active in civic groups, faith-based groups, or other local organizations provides social support and can help them reclaim hope. Research groups in your area that could offer you support and a sense of purpose or joy when you need it. Finally, to build resilience, we must find meaning. We can do this by helping others, being proactive, moving toward our goals, and looking for opportunities for self-discovery. Even with the tools that we've provided here to build resilience and to withstand the stresses of COVID-19, you might be wondering when it's time to seek help. If you begin experiencing intrusions such as nightmares, flashbacks, or intrusive thoughts, hyperarousal such as anxiety, insomnia, irritability, if you're avoiding reminders of a traumatic event or avoiding feelings by using substances, if you begin feeling numb, spaced out, or as if things aren't real, and if your daily functioning becomes affected by any of these things, it might be time for you to reach out and ask for help. If you do need help, call 833-367-4689. The Heroes Helpline is here for you.